Ibuprofen is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Check the ingredients on the label even if you have used the product before. The manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking Motrin IB, be sure to read all directions on the product package if it's over the counter, or the medication guide provided by your pharmacist if it's prescribed by your doctor. Take the medication by mouth with a full glass of water every 4 to 6 hours, unless your doctor tells you otherwise. To reduce the risk of side effects, take the lowest effective dose for the shortest possible time. If you're giving Motrin IB to children, be sure to follow the dosage instructions based on the child's weight. And if your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Common side effects of Motrin IB may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. However, this medication may raise your blood pressure, so be sure to check it regularly and inform your doctor if it is high. Contact your doctor immediately if you experience serious side effects such as easy bruising/bleeding, changes in hearing, mental/mood changes, signs of kidney problems, vision changes, symptoms of heart failure, or symptoms of liver damage. Although rare, a serious allergic reaction to this drug may occur, so seek medical help right away if you notice any symptoms. If you experience any other effects not listed here, contact your doctor or pharmacist. Nonsteroidal anti-inflammatory drugs, like ibuprofen, could potentially increase the risk of a heart attack or stroke, especially if taken for a long time. This risk is higher in older adults or those with heart disease, high blood pressure, or diabetes. It's important to avoid taking ibuprofen before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines while taking ibuprofen, especially in older adults. Seek medical help immediately if you experience severe stomach pain, black/tarry stools, or vomit that looks like coffee grounds. Also, be aware of symptoms like chest pain, shortness of breath, weakness on one side of the body, or sudden vision changes. It's important to discuss the benefits and risks of taking ibuprofen with your doctor or pharmacist. Before taking Motrin IB, make sure to tell your doctor or pharmacist if you have any allergies to ibuprofen, aspirin, or other NSAIDs. Also, let them know about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or throat/stomach/intestinal problems. Be cautious of kidney problems that can occur with the use of Motrin IB, especially if you are dehydrated, have heart failure or kidney disease, are an older adult, or take certain medications. Drink plenty of fluids as directed by your doctor to prevent dehydration and let your doctor know if you have a change in the amount of urine. This medication may cause dizziness or drowsiness, so avoid driving, using machinery, or doing anything that requires alertness. Limit your alcohol intake and consult your doctor if you are using marijuana. It's important to be aware of the risk of stomach bleeding with the use of Motrin IB, especially when combined with daily use of alcohol and tobacco. Limit your alcohol intake and stop smoking, and consult your doctor or pharmacist for more information. This medication may make you more sensitive to the sun, so limit your time outdoors, use sunscreen, and wear protective clothing. Let your doctor know if you get sunburned or have skin blisters/redness. Before any surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using Motrin IB. If you are a woman of childbearing age, talk to your doctor about the benefits and risks of using Motrin IB. Let your doctor know if you are pregnant or plan to become pregnant, as this medication may harm an unborn baby and cause problems with normal labor/delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. You should not use this medication after 30 weeks of pregnancy. If you are breastfeeding, consult your doctor before using Motrin IB. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Motrin IB include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, and water pills, diuretics such as furosemide. Motrin IB may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Check all prescription and non-prescription medicine labels carefully since many medications contain pain relievers/fever reducers. These drugs are similar to ibuprofen and may increase your risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless your doctor instructs you otherwise. Daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke. Talk to your doctor about using a different medication to treat pain/fever. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen. Take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Do not increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. If someone takes too much Motrin IB and has serious symptoms like passing out or trouble breathing, they should call 911. Otherwise, they can call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. If your doctor has given you Motrin IB, it's important not to share it with others. Your doctor may also want to do some tests, like checking your blood pressure or kidney function, while you're taking this medication. Be sure to keep all your medical appointments and ask your doctor for more information. If you're taking Motrin IB regularly and you happen to miss a dose, take it as soon as you remember. But if it's close to the time for your next dose, just skip the missed one and take the next as scheduled. Don't take a double dose to make up for the missed one. It's important to store Motrin IB at room temperature, away from light and moisture. You shouldn't keep it in the bathroom and make sure to keep all medications out of reach of children and pets. When it comes to disposing of Motrin IB, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.